time is not the money.
Good evening, everyone.
Good evening.
I hope everyone can hear me.
Yeah, we can hear you.
Thank you. Can you all see my screen?
Yes.
Okay, thank you. So today we are going to do session 14 on building a healthy
Good
mother
evening.
and child training. And our topic today is FGM and maternal health, and I'll be your speaker, Katile Mutuku, and I hope we'll have an interactive session. Let me just put my video on. In case you hear background noise, I can put it off. So as I've said, I'm Katile Mutuku. I'm the founder and director of Barrier Breakers with the Initiative, and I hope you all know me. So today I'll be talking about FGM and its relationship to maternal health. Do you know that Kenya is currently ranked the third amongst countries with medicalized female genital mutilation? That is in Africa after Egypt and Sudan, which is the second. And FGM has affected 5 million girls, affects 3 million girls a year. That means 1 in every 10 seconds, there's a girl who undergoes FGM, and the national prevalence in Kenya is about 21%. So I just have a question. In which countries do you think in the world practice FGM? You can just write in the chat box, which countries in the world do you think practice FGM apart from Kenya, Egypt, and Sudan? Immaculate, thank you. Tanzania. Okay, let me just assume the others who don't know which countries undergo FGM. Teresa, thank you. Kenya. So my second question is, do you think these statistics are correct about we having like one girl each second undergoing FGM? Do you think they are correct? You can just use a yes or no on the chat box. Thank you, Michelle is saying yes. Do you think these statistics are correct? Okay, my third question is, do you think that they have gone, the statistics, do you think the cases of FGM are going up or they are going down since 2014? They are decreasing. Thank you, Michelle. Immaculate down. And I hope you can all see my screen. Thank you, Rose. They are all going down, but in some countries, they're still increasing. Thank you for your responses. So the prevalence of FGM, FGM is also called female genital circumcision. Globally, at least 92 countries around the world undergo FGM, and there are around 2 million reported cases globally in Africa, Middle East, and Asia. And as you can see, we have 4 categories. Sorry for that. We have 4 categories. Category 1, the dark purple labeled countries. They are the countries where we have reported cases of FGM have been reported, and yeah. And then we have category 2. We have, to some extent, we have reports of FGM. We have category C in the Asia. We don't have adequate information about FGM. And in the category 4, we just have media reports their cases, but they don't know if they are cases or we don't have cases. So the prevalence in Africa, according to 2015, 4 million girls have undergone FGM globally. In the year 2015, 4 million girls underwent FGM. And by 2030, it is seen that if legislative measures are not taken, we'll have more projected to have 4.6 million girls undergoing FGM. And as you can see in Africa, the prevalence is in Sudan. We have Egypt, we have Mali, we have Guinea-Bissau, the red colored countries. We have 80% of the girls undergo FGM. And the countries labeled gray, we have, with their countries where FGM is not concentrated, maybe few girls undergoing FGM. And the other countries, 51 to 80% orange. The countries labeled dark orange, I guess, dark yellow, we have 26 to 50%. Kenya lies there, and we have 10 to 25% in the countries labeled blue. So according to the Kenya Demographic and Health Survey 2014, we estimate that between 15 to 49 years, girls and women, 21% prevalence. That means 21 in each 100 girls are undergoing FGM. We have 15 to 19%, 19 years old girls, we have 11% prevalence, and 10 to 14%, there's no reported prevalence. And in Kenya, according to the early provinces, Northeastern has the highest rate of FGM, that is 97.5% girls undergo FGM. So as you can see, and at Western, there are lower cases of FGM, that is 0.89%. So distribution according to ethnic groups in Kenya, the Somali women undergo FGM, that is why in Northeastern we have 97.5% cases. And as you can see, we have Somali, Samburu, we have the Kisii, the Maasai, other communities, Embu and Meru at 30.7%, the Kalejins. And currently we have high rates of FGM in Kalejin, so maybe there will be a change in the next KDHS. We have Taita Taveta, Kikuyu, and Teluo. They are not currently practicing a lot. So you will find that most cases of FGM, they are in the rural areas, that is 25.9%, compared to those living in urban, that is 13.8%. But as you can see in the demographic history that was taken in Kenya in 2009, the cases were more, but currently they are reducing in rural and in urban areas also. So I will just ask a question. We know we are after the COVID-19, and there are measures that were taken during the COVID-19. So my question is, do you think the prevalence of FGM has gone high or has gone low after the COVID-19? You can just use the chat box. Do you think the prevalence has gone high or it's going low? Thank you, Immaculate. Immaculate saying it's going high. Another person? I'm waiting for your responses in the chat box, or you can just unmute and say, do you think the rates of FGM are going high or are low when there was Corona until now? Okay. So I'll go to the next slide. If you don't answer, I'll just continue. COVID-19 and FGM, the number of FGM.
Excuse me, Katile.
Within COVID-19 response strategies. So
Katile,
it left many girls at risk and survivors with no recourse of essential prevention protections. Like during the COVID-19 response strategies, we did not see any strategy to curb FGM. So that means there are increasing rates of FGM in Kenya. And the essential health services and safe spaces for youth at risk and survivors of FGM, there are few in Kenya. And due to economic hardship, maybe some parents will seek bride prices, others do cuts previously in practices which were abandoned. Practices which are abandoned in order to seek like this economic hardship to get money in case of bride prices. So we have few CBOs, that is community-based organizations supporting FGM, and the shrinking resources among civil societies. So that means there are increasing risks of FGM in Kenya. So what is FGM? I just need someone to unmute and say, what is FGM and what do you know about FGM? Maybe some of the different types of FGM that you know. Someone? Nathan?
Yes.
Nathan, I can't get you. Someone else? Ross?
Hello, it is female genital mutilation.
Ross, do you know some of the types of FGM?
No.
Okay. Someone else? Okay, let me just go ahead. Maybe some of you don't know what is FGM.
Well, there is
Jackie, yeah.
infibulation.
Teresa?
There is a type that is called infibulation.
True,
It's
yeah.
a type of FGM. Yeah.
Okay. So let me just continue so that you can get a briefing of what is FGM, what are the types of FGM. So what is FGM? That is female genital mutilation or female genital circumcision or excision or genital cutting. It comprises of all procedures, any procedure that will involve partial or total removal of the external female genitalia or other injuries to the genital organs of a female for medical reasons. And it's mostly carried out between infancy and age of 15, but you can still find at the age of 49, there are women who undergo FGM. And this procedure has no health benefit to the woman, to the girl, because it is usually performed without permission and against the will of the person it is performed to. And this means it will violate the girl's right, it will violate the woman's right to make important decisions about their sexual and reproductive health. So these are some of the tools that are used in FGM. It's disgusting indeed. So this is how the female reproductive external genitalia looks like. This is the mons pubis, this air. We have the clitoris, this is the sensitive part. We have the outer labia, this will be the labia majora, I guess. Inner labia, labia minora, and then we have the vagina opening, we have the urethra opening here. So just keep in mind this picture as we go to the different types of FGM so that you can get a clue on where FGM is performed. So type 1 FGM. Type 1 FGM is called clitoridectomy, and you'll have partial or total removal of the clitoris, this part. So it can be partially or totally removed. And you know, this is a small and sensitive erectile part of the female genitalia, and it's done in rare cases, but in very rare, only the prepuce, the folds surrounding the clitoris are removed. And as I can say, all types of FGM, they are painful, extremely painful. They are distressing and damages sexual sensitivity of the skin and can cause infection to the female. Type 2, it will involve partial or total removal of the clitoris and labia minora, the inner folds of the vulva, with or without excision of the labia majora. As I've shown you, this is the labia minora, the inner part, labia minora, and the outer part is the labia majora. So you have the removal of the clitoris and the labia minora, and you can have also the removal of the labia. majora, but it's not a must. And to show it's painful, distressing, and sexually sensitive skin, you damage it and you can cause infections. So we have type 3 of FGM. You want to narrow that is infibulation. Type 2 is called excision. Type 3 is infibulation, narrowing of the vaginal opening through the creation of the covering seal. So you want to narrow the vaginal opening and you want to you form a covering seal. And the seal is formed by cutting and sewing the outer labia. So you will cut the outer labia and then you see it. You saw it, and then without the removal of the clitoris or labia minora, so it's not a must to remove the clitoris or inner labia. And the closing of the vagina and the urethra leaves the woman with a very small opening. As you can see here, we have a very small opening where you can pass urine and menstrual fluid, and the opening can be small, so small. Actually, most of the women are cut during when they're giving birth, and can bring actually complication to both the mother and the baby, because this can lead to like labor can increase and then you'll have to be cut. And also it's painful actually. And this is the FGM type that is practiced mostly, the infibulation, that is the type 3. And you have the type 4. These are unclassified, that is any harmful procedure that is done to the FGM for non-medical purpose. Maybe you are pricking, maybe you hit the external genitalia, maybe you pierce it, you make incisions, scraping, stretching, coastering the female genitalia. And as I've said, that we have a rising trend that has not where subcommittee, especially those that practice type 3, are now changing to type 2, that is excision, and type 1 clitoridectomy. You can still watch the video. You can watch later. This is just a summary of the types: type 1, type 2, we have type 3, and then we have type 4. You can pierce, prick, you can burn, you can stitch. And how do we manage FGM? Management of FGM, that is for girls and women affected by FGM, you determine the complication. It differs with every girl, so you'll treat each girl and treat every woman as an individual. Don't treat them as a group. So how do you notice that someone has these problems? Maybe they have problems with sexual intercourse, problems with urination, the infibulation. The infibulation is FGM reversal. Maybe you are stitched, so you want to cut the stitches so that the closed vagina can be big, like larger. So you can have complications due to that. You can have problems during or following delivery. Maybe you have obstructed labor, you have labor, those tears after labor, you have urethral injury. And this is mostly in second stage labor and local anesthetic. Anesthetic is that drug that you're given to reduce the pain during maybe surgery, something like that. And then individual problems such as you can have an infection, you can have adjacent organ damage, fistulas, but you will manage every condition in individual basis. So mostly the ways that are done to manage FGM, we have the infibulation, which is a surgical procedure to open the closed vagina of type 3. But this is it is done medically, and sometimes can be done medically and you have complication. But the reinfibulation, that is restructuring, the restriction of type 3 FGM to reclose the vagina again after birth, it's not mostly done. Mostly the infibulation is done. So these are the preferred terms that you use. We use female genital mutilation, circumcision, or cutting. So I can just give an opportunity for 3 people to speak. What are the different causes? What do you think are the justifications for FGM? Why do people practice FGM? randomly. 3 people kindly.
Maybe cultural belief. So some people believe in a culture that not
Okay, Veronica, I've not heard you clearly.
Let me try.
say it.
Yes, to reduce.
Come up kindly, Veronica.
Say one of the reasons that people practice FGM that there's some cultural belief that the FGM is a person. So those people that got the information that effect of the FGM attempted to these cultural practices and they do it. So maybe cultural practices is one of the reasons.
True, Veronica, cultural is one of them. Rose was speaking. Thank you, Veronica. Rose Ochola.
Yes, FGM is practiced to reduce the urge of sex. That means that the person here is just to be with the partner only, maybe
True.
for the sake of getting children.
Thank you, Rose. That is true.
Hello.
Hello.
Are we saying the truth or the myths why FGM is practiced?
All of them.
Oh, okay. I think some are practiced as a rite of passage in different cultural practices, so that they can be acceptable in the community.
True, Joanne. That is true. Nathan is saying in the chat box, some women see it as a source of honor. True, that is true, Nathan. Thank you all. So let me just go ahead. Thank you. So we have different rationales or different reasons for FGM, and these are based on the cultural, social, and religious background of the communities of those people who engage in the practice. And it can be socio-cultural reasons. Some communities practice FGM to see it as a prerequisite in maturity or transition from childhood to adulthood to enable them to carry out marriage, childbearing, and other communities' affairs. Psychosexual reasons. We assume in African society, we assume that women are weak in areas of emotion and they are not able to control their sexuality so far. So that means uncircumcised girls are assumed to run wild and to lose moral, bringing shame to their parents. And here, FGM is practiced to reduce the girl's sexual desire and prevent sexual experience before marriage. As I think Rose said that, to reduce unfaithfulness in their marriage. Another reason, we have spiritual cleansing reasons, and in FGM is mostly practiced in the Muslim communities. They believe that the sooner circumcision is mandated in the Quran and following the tradition of the Prophet Muhammad. And however, it's not practiced by all Muslims, and it has been wrongly associated with Islam. And the main teaching in Islam and Christianity, they show that in the holy books, Quran and Bible, they do not prescribe or enforce practice of FGM. Though in the Muslim community, as you can see, there are 51% Muslim practice FGM, and 67.1% they do the cutting plus removal of clitoris, and the sewing of labia majora is 67.1%. And also in Christian, you can see like 21.5% Roman Catholic practice it, and in Protestant Christian women, you have 78.9%. We can also, some people practice FGM due to hygienic and aesthetic reasons. Communities believe that external genitalia is dirty and unsightly, and it can continue to grow bigger, and if you don't cut it, so you cut it to promote hygiene, prevent illness, and provide aesthetic appeal. This is just a summary of what I said. You want to preserve virginity and chastity, religion, fear of social exclusion. I remember I was listening to a documentary in, I think, FGM in NTV some times ago, and they are saying that if a girl is not circumcised, the other C is not part of the community, and actually you're excluded. And yeah, it will ensure that you are married, hygiene and cleanliness, enhance fertility, family honor, as Nathan said, and social acceptance. So, as you said, FGM has no health benefits. Actually, it will bring more harm to the woman and the girl. And as you have said, there's no religion that supports FGM. This is just a summary of the same. You do FGM due to family and peer pressure. I think that was to reduce libido, yes. Okay, health impacts of FGM. What do you think, according to what we have gone through, what do you think are the some of the potential short-term and long-term consequences of FGM? You can use the chat box. What do you think how will be the female affected if they undergo FGM? Feel free to unmute or use the chat box. Thank you, Immaculate. Psychosocial trauma. True. Someone else? Are we no? Thank you, Death. Yeah. You can unmute. Infection. Thank you, Alice. What else do you think can be a complication of FGM practice into the health of the female? Another source of infection, true. Don't you think pain is part of the health impacts? FGM is a source of pain. Mary Kirangu, true. HIV. Okay, thank you. Let us start with the short-term complications of FGM. So, short-term health impacts of FGM, severe pain. You know, if you cut the nerve endings and the sensitive genital tissue, mostly the clitoris, you have extreme pain, and proper anesthesia, that is a drugs that are used to reduce pain, should be used, but you know, it's not always effective. And honestly, the healing period is also painful. If you can listen to documentaries of women who underwent this cutting, it's so painful. Excessive bleeding, we can have hemorrhage, that is excessive bleeding, and can result in the clitoral artery or the blood vessels cut during the procedure. Shock. Shock is caused by pain, infection, and hemorrhage. Genital tissue swelling, you can have, you know, if you are cut or you are burned, you have an inflammatory response. So that is why you have swelling, tissue swelling, genital tissue swelling. You can also have infections. I showed you some of the tools that are used in FGM. So you can have the same tools, they're used for different women. So you can have infections, or they are not cleaned, or the person who is doing the procedure doesn't use items, or doesn't observe hygiene, or doesn't use clean items, that is sterile instruments. So it can lead to infections. HIV, as you said, you are using the same surgical instrument without sterilization, you increase the transmission of HIV. Urination problems, as you say in type 3, you are reducing the vaginal opening. You have a small opening for urine, and you will have pain when passing urine. You know, it's like palumeccato. Obviously, you will have pain. And you can also have injury of the urethra as the procedure has been done. You can have impaired wound healing, that the wound can take pain, it can take long to heal, and you have pain, infection, abnormal scarring. There's a woman who was saying it took her like almost 2 years to heal, the wound to heal, and it was so painful, and she stayed in the house for the 2 years. Psychological consequences. It is done by force. You are tied your hands and your legs, and you cannot move. And it's not your right. It is not, you have not agreed it to be done. So you can have psychological consequences like pain, shock, death. Death can be caused by the infections, the hemorrhages, the tetanus. This is a story of 2 sisters aged 10 and 11 who bled to death. This was not last week, it was in 2021, after they underwent 2018 in Somalia, when they underwent FGM. So this is just a summary of what I said. So long-term impacts, you can have infection like chronic genital infections, you can have chronic pain, vaginal discharge, itching, cysts, abscess, genital ulcers may so occur. Chronic reproductive tract infection, like in the chronic back, you can have pelvic pain. You can have UTIs. If not treated, UTIs can ascend to the kidneys. There is the lower UTI. We had a session on that. Lower UTI infection can access to the kidneys. That is the upper part of the urinary tract. Can result to renal failure. Septicemia is blood infected with bacteria, and also can lead to death. So menstrual prevalence, you can have obstruction in vaginal opening, which may lead to painful menstruation, that is dysmenorrhea, irregular menses, difficulty in passing menstrual blood, especially in type 3. Keloids, you have excessive scar tissue formed. When you are cut by something, there's that scar formed. If you can see some people have a very big scar, that is what we call keloids. HIV, female sexual health can be affected, like the clitoris, the highly sensitive genital tissue. So we will affect the sexual sensitivity and lead to sexual problems like this: decreased libido, pain during sex, difficult during penetration, decreased lubrication during intercourse, and organism scar formation, can have pain, traumatic memories. That has psychological effects of FGM. Obstetric complications. FGM is if you undergo FGM because you have to be done defibrillation during giving birth, most women nowadays, you have increased risk of you being done cesarean sections. We have postpartum hemorrhages, you have recourse of episiotomy, difficulty in labor, obstetric tears, instrumental delivery. We have prolonged labor. Actually, prolonged labor is very common. Extended maternal hospital stay. We have obstetric fistula. Is this a direct association with FGM and obstetric fistula? It's not well established, but there's a relationship between the prolonged and obstructed labor and the fistula. And yeah, so we just assume that the two conditions are related. We have perinatal risk, complications, in higher incidence of infant resuscitation. That is, we have many complications that can occur to the child, the infant that is given birth. You can have sometimes preterm birth, you can have neonatal death. Psychological consequences, you can have anxiety, you can have depression, you can have post-traumatic stress disorder. So you should protect these people. The reason why we should fight against FGM is not only about the health impact, but also the psychological consequences. I think this is just a summary of what I said. And as you can see, the impacts of FGM, you can have pain, you can have hatred of sex. You can have you can lose chances, you can lose baby, you can lose decrease in education, you can even lead to possible death. As you can see, there are many impacts of FGM. From hatred of sex, you can have psychological, emotional, spiritual trauma, which can lead to social isolation. You can have impaired emotional, sexual relations, can lead to increased STIs. You have loss of children and family, you have social isolation, and this will lead to increased variability, which extends through generation, increased mortality. If you can have menstrual problems, can use increased morbidity, obstetric fistula, childbirth complication, premature birth, low weight birth, can have fetal distress. You can have increased neonatal and infant death, can have malnutrition in children, decrease in learning ability, decreasing in earning ability, threatened livelihoods, increased asset of poverty. As you can see, one complication will lead to another, and this means all the impacts are related. The medical, psychosocial, and the end results are so painful to those who undergo female genital circumcision. So, policy and legislative environment, we have policies, we have acts that have been passed to fight FGM globally, regionally, and nationally. So we have the international conventions and treaties. In Article 2 of the Constitution of Kenya in 2010, we have provide laws for treaties and conventions. And you have these are just examples. Convention of the Elimination of Discrimination Against Women. We have Beijing Declaration and Platform for Actions. We have the African Charter on Human and People's Rights on Rights of Women in Africa, the Maputo Protocol. We have Organization of Islamic Cooperation, which was done in Cairo to fight FGM. The government of Kenya, within the Bill of Rights, prohibits violence against women and harmful practices. And in 4th June 2019, the President Uhuru made a formation to put an end of FGM by the year 2022, but we are in 2022, and I can say we are still in Kenya. And as I can see, we are still in Kenya. You know what you mean in Kenya. We are very good in making policies, but implementation is a very big problem. So the Prohibition of Female Genital Mutilation Act number 1232 of 2010, which was revised in 2012, and it became a law in 4th October 2011, criminalizes on FGM, and these are some of the things that it criminalizes against: training to perform FGM, aiding and abetting to FGM, procuring a person to perform FGM, use of premises to perform FGM, failure to report commissions of FGM, and use of abusive language intended to ridicule or embarrass a woman who is not undergoing FGM. And this act is a great success toward the eradication of this vice and improvement of the existing laws of FGM offenses in Kenya, which is mainly consistent in the Children's Acts in 2001, Article 14 and 119, the Penal Code and Nurses Act, which was made in 1983. These acts are legislative measures that are put in order to aid FGM. As you can see in the Declaration of the Rights of Children in 1959, you say that all children shall enjoy special protection, shall be given opportunities and facilities by the law and by other means to enable them to develop physically, mentally, morally, spiritually, and socially in a healthy and normal manner in condition of freedom and dignity. So, although there's a current trend of increase in medicated FGM practices in Kenya, it has been held for its laws on FGM. But although we have laws, we still have FGM cases rising each day. So we have the Protection Against Domestic Violence Act 2015, Article 3 and 19, term FGM as a violence, and this will put protective measures to the survivors and victims of domestic violence, including FGM. And these are some of the seats, the places where the policies are made on FGM, the Ministry of Health, county anti-FGM steering committees in mostly these are done in counties where we have FGM. I remember there was in Kajiado, they have policies that have made on FGM. We have Director of Public Prosecution Office, Judiciary, Ministry of Education, Ministry of Devolution and Planning, State Law and Office, Justice, Ministry of Interior and Coordination, the National Policy for Eradication of FGM, Sessional Paper 93, 2019. But this is just a question I have for you. In your opinion, do you think the FGM-related laws enforced adequately in Kenya? Do you really think these laws in Kenya, which have been said and been talked about in FGM, have been enacted?
No.
Thank you. As you know, I think the problem in Kenya, we are very good in making policies, but each and every day we complain about that. So I usually don't know who will make the rules act, but as you can see, another documentary was saying that mostly in some communities in Kenya, I think the Tugen, I don't remember the right community, but find that the politicians themselves, they go and make the rules. But when you go back to their community because they want votes, they will go and make partnership with the chiefs, with the elders, and promote FGM so that they can get the votes and come back and take money, as you say. So yes, it is Kuria, Jeremiah Mboya, thank you. Yeah, in Kuria land, actually, I think in the last 3 weeks, there were reported high rates of FGM taking place in Kuria. And we are still wondering, are the same people and the same politicians in those areas the same ones who are making these policies? Just give me a minute, I sent the attendance list. Sorry for that. I think I shared the attendance list to Edwin. Edwin, you can check your WhatsApp and then share the attendance. The moderator of the day is not in. So I just shared to Edwin. Edwin will share the attendance form. I'm not using my phone. So thank you for your answers. No, we don't have adequately enforcement of rules in Kenya. So let us continue. Anyone can just inbox me and send the attendance form and then they share in the group. So which human rights are violated by FGM and legal implications? We have the right to life and physical integration, right to education. You know, if a child undergoes FGM, it will take long for them to go back to school, right to be free from gender discrimination, the rights of the child, the right to health, the right to dignity and physical integrity, the right not to be compelled to undergo any harmful practice. We have so many rights. We have so many. Kindly, if someone can just inbox me, I share them the attendance form. So we have different rights which have been violated when you do FGM. I know you know many other rights. You can just put them in the chat box. Rights. Thank you. John is saying my community at Illet does not know FGM is illegal. True. even the awareness and anything to do with FGM, people don't know and don't know if it's illegal, and others don't know the complication. They just see them as normal because it's prestige. You bring honor to you. You get honor when you do FGM. So yeah, someone said freedom. You have freedom of violence. You don't have freedom of expression because you're forced as a child to go through FGM. So let's just continue. The effects of FGM on realization of SDGs. During our orientation session, we had a session on SDGs. And as you know, FGM is about health, and SDG number 3 is about good health and well-being. So if, as observed in the previous slides and what I've talked today, FGM, it will impose immense health impacts to the individual and the society, and therefore it will threaten the good health and well-being of all genders and ages. As you know, if your family member is affected by a certain illness, you have to take care of them, so you'll be affected in one way or another. Quality of education. You want to marry off the girl, no matter the age, no matter how wise she is. So you are setting back this girl's future. You are denying her future. Gender equality, you know, like, why is it done to women alone? You know, there are similar things that are done to men. We have the male circumcision, but the male circumcision has many benefits and few get problems. But this SDG number 5, we have gender inequality. We are depriving women and girls of their basic rights and opportunities that they can get because you are denying them freedom. You are making them, you are denying them freedom. You are discriminating them. You don't want them to associate if they don't undergo FGM. That is, you are denying them freedom from violence. Yeah, girls should have freedom to choose if they want their bodies cut off or not. But you know, as a young one, you do as your parents say. So we need to educate people about FGM. What are indicators that a girl might be the risk of FGM? So what do you think are some of the factors that may make a girl undergo FGM? So that is my question. What do you think are some of the factors that can make someone undergo FGM as a girl? Feel free to unmute. What are some of the reasons you think can make you, apart from the myths and misconception, what can you make me, for example, what can make a Chile undergo FGM? For example, what, if I give you the example, you just know the answers. What are the probable reasons why I can undergo FGM as a young girl? Thank you, Alice. Pressure from the elders. Obviously, if your elders, if your parents give you pressure, you'll undergo FGM. Another factor. Thank you, Alice. I think the question is tricky, so let me just give a brief. So the key indicators that a girl or young woman is potentially at the risk of FGM, they are mainly two. One or both of the parents come from ethnic group that traditionally practices FGM. Honestly, if my parents or one of my parents comes maybe from Somalia and they practice, so obviously, what will make me not undergo FGM? Maybe my mother went at FGM, this practice, and didn't get complications. Obviously, she didn't receive this complication. Why not me? I will undergo these things, these acts of FGM. and the girl should be viewed at a risk if maybe also an older sister, my elder sister will undergo FGM. Obviously, I might very high risk of undergoing FGM. Maybe my cousins the same age underwent FGM. Obviously, the mother or has requested infibulation following delivery. Some mothers, they want to be stitched again, so they will undergo second time of FGM. Actually, some people undergo FGM many times. The parents express views which show that they value the practice. So if my mom, my dad view FGM as a good practice, then I'll undergo this process. Naso lack of knowledge of whether parents or the girl themselves, true. Let me some comments in the culture, peer pressure, Rose, Kelvin, Curie is saying culture, Alice saying education, Alice lack of knowledge, true. In some communities, yeah, some communities is a rite of passage. Rose Charlie saying, yeah, thank you all of you. Okay, I think I've read all comments in the WhatsApp in the chat. So let us go to the next slide. So where can girls and young people get support from? Maybe someone doesn't know about FGM, or if there's a girl in the village who is fearing to get FGM. So you can encourage the girls to seek support from their teacher or other educational professional. But you know, if my teacher underwent this and sees it as good, he will encourage. So someone should be choosy and choose someone who's approachable, and mostly someone who's talking about anti-FGM. School nurse, friends, police, social services, helplines dedicated to support children and young people, and any FGM organization that is working on human rights, or any other organization that is working on human rights. Yeah, Rose is saying chief, true, but wale chief wa Kuria, they are very good supporters of FGM. Frederick is saying social workers, true. Community workers, social workers, true. So as you can see, if you want to assess support, you should look for a person who you think is a anti-FGM person, or maybe someone who underwent FGM and is talking against it. Because if you seek it from maybe a politician, and this politician wants your vote, obviously they will support it. So let me continue. Assessing support from health services. So health services can provide support and treatment. Women can assess the help they need by speaking to their doctor, health visitor, or midwife, or can attend a sexual health clinic. Support should be offered in relation to the trauma. As I said, you treat a person as an individual. You don't treat, as a doctor, you don't treat just anyone. You will treat someone as an individual according to the complication that brought them, not according to the complication that everyone is out to get. Yeah, Rose is saying human rights activists, true, that is so true. Maybe I can hear from you. Do you know any local contacts and services that are relevant to FGM, apart from the national, from the government ones that I mentioned? Maybe if you know some of the contacts and services, you can put in the chat box, or you can just unmute. I'll give you 1 minute to do so. It's Alice, is it Red Cross or Red Cross? Yeah, thank you, Alice. Any other one? You think it supports human rights? Maybe a CBO? I'll give you 1 minute. Yeah, WHO. Thank you, Alice. Frederick is saying UNICEF. Thank you, Ross is saying UNICEF. Any organization that you know that supports FGM or supports human rights? It's not a must, it's an international organization, because you are in Kenya. Where will you reach out to an international organization? Frederick is saying World Health Organization, call it care. Thank you. I think that is a task that we should look on. Which CBOs do you know that are promoting FGM? Which organization do you know promote human rights? I think there's Amnesty organization that is promoting human rights in Kenya. So actually, even that's why I'm saying in Kenya, we are good at making policies, but in making implementation, we are very poor. As you can see, we don't know which organizations support human rights. We don't know which organizations are anti-FGM organizations. So where will we get help in our county? Also in our counties, we don't know the anti-FGM committee board members. And our chiefs, maybe they don't know anything to do with FGM. So we have a lot in advocacy and creating awareness on FGM. Even if your community doesn't undergo, we need to help others to know why FGM is not good. So the next one, what are the gaps and areas of interventions in FGM? In 76% and 10 to 6% of women and men respectively, still believe it is a requirement by the community. Actually, mostly men in the affected community believe that this FGM is a requirement by the community for their young girls to transit from childhood to adulthood. The continuation of FGM in communities to a failure to manage the social change process. That means we have a discordance between the law, medicine, and cultural practices. You know, there is non-medical FGM, there's medical FGM. So you'll find some of the people in Africa, they'll be going to outside Africa to be done to have medicated FGM. There is also this documentary that was saying that in Kenya, because we have laws that are condemning FGM, you find that there is cross-country FGM that is undergoing on. So the elders and the community leaders in Kenya, they transfer the girl, they know those in Tanzania, and they will transfer their girls to Tanzania. The FGM practice will be done there, and then the girls will be returned to Kenya. So actually the cross-country FGM practice is the emerging issue in FGM, because now where will you do? Where will you get them? They're not doing the action in Kenya, they are doing it in Tanzania. So who are you to blame in Kenya? You don't know. And if it is a medical FGM practice, yeah, we don't know if is it lawful, if it's done medically, is it not lawful? So there are some of the areas and gaps in FGM practice. We haven't a reporting of the practices. We know there's in Korea, there are high races of FGM, but you know what? You'll not go to mention it because you'll be blocked. The chief will block you, the MPs, those politicians in those areas, they will highly support those elders to get their votes. So who will you talk to? Even if you report, who will act? Even if you report to the police girl and the police cousins and their nephews, their nieces, they support FGM. So how will they get help? There's rebellion of legislation even from the enforcers and a budgeting by counties towards FGM. We saw the health budget underwent down. The budget for pads even went down. So the budget for these things that we think they are very good, we have very good policies on FGM. But if you see in the budget, they are cutting down these budgets of what you think it is important in health matters. So what can you and I do? We can have empowering education forums that you help people examine their own beliefs and values related to FGM dynamic and open way that is not experience or threatening. We can have public dialogues to create awareness and understand by the community. You know, if you want to go and educate a community against their belief, you must first understand what do they believe this. And you get this information from the elders, you get this information from people who are from that community that didn't undergo the cut or who underwent the cut and they are against FGM. You have public dialogues with them and you have to understand them and to explain to them in a very respectful way. We have social media platforms. We're always on the phone. We are always seeing this, but you don't speak out. Yeah, we saw what happened in Korea, but since you are too easy tweet, we can't tweet about it. And you know, in Kenya, social media is a very powerful behavior. So when SIM cards, we are told to register SIM card and people were against it. Yeah, they stopped that act and postponed it. But when it comes to things to do with health matters, everyone thinks because I'm not affected, then it's their problem. You don't know the next generation, you don't know your kid, your child or your cousins or your friends might undergo this or they are having these complications. So just think about it. You can have alternative rites of passage. We can have scholarships for the girls who remain uncut. You can think of opening CBOs to promote as rescue centers for these girls. Yeah, you can think about anything that you can do to bring this information about FGM in limelight or reporting of these cases. So what is the role of students and youth in curbing FGM? You have to challenge the discriminatory reasons of why FGM is practiced. If you can't challenge something, then it can't be acted on. You have to change the negative traditions with the support of older generation. As I've said, you need the support to do these things. If you don't have the support of the older generation in that community, then you won't be able to campaign against FGM. Actually, utafukuzwa. You have to educate girls on their rights. Let them know that their bodies are their rights and they should know what should be done to their bodies and what is not to be done. In schools, the teachers need to educate these girls in the areas that are mostly affected, that it's their right to say no to FGM, it's their right to run away, and that means we have to have rescue centers in this area. We have to speak about the risk and realities of FGM. We know there are many myths and misconceptions surrounding FGM. If you don't speak about the risk and the realities, the complications, then nobody will hear you from that community. You have to spread understanding that religion does not demand FGM. As you see, many people say, oh, Islamic, the Sunnah laws, they support FGM, but yeah, it's not true. It's not true that some religions support FGM. It is the cultures that support FGM. We have to tackle the secrecy that allow cutting to continue. You have to know, why is it done? Which ways do they use? Okay, we have to keep pushing FGM to be banned by participating in public policy dialogues to communicate findings on the ground. You know what is being done in your community, you can't come out and speak. You don't know even where meetings are held on public. You don't want to waste your 2 hours if you're not paid to go and speak to in a public policy dialogue forum, but you expect some things to be changed. It can't be changed if you're not there. The people who are making these policies, they don't know even what undergoes in the ground. So we need youths, we need students to come up and participate in dialogues to communicate their findings on their ground, carry out researches on how it is done, which secrets are undergoing in the community. And you know, any FGM case, you report where you have knowledge, but just ensure you have knowledge about what is undergoing so that you can be defensive. Mhm. So what can you do? Maybe you want to be a trainer and you want to be talking about FGM. So you have to understand children's rights. You know, most people undergo this act when they are young. So you have to understand children's rights. You have to know the articles on children's rights. You have to have good communication skills. Try to listen to the elders sensitively. Use value neutral terms. Don't understand what the community calls FGM and try to speak in a neutral term that you're not lying once, and you have to listen respectively. As I said, you go to the field as a researcher, don't go as an expert, don't go in a community as if you know everything that undergoes there. You go as someone who doesn't know anything and you want to learn so that you can understand and get these secrets well. Obviously, if someone knows you are coming here so that you can stop what they are doing, they'll not tell you the truth. So you have to speak to older women, young men, young women, older women separately. The older men will tell you something. The older women will tell you something. The young men will tell you something, maybe that what they were taught to do in circumcision and yeah. The young women who have undergone FGM, they'll tell you what they have underwent and this is what and this is what is done and this is what is not done. So you know how you will reach out. I think we can also plan maybe after the trainings, maybe around 3 sessions on how you can conduct trainings on FGM or generally in reproductive health, so that you can know how to engage the youth and how to engage the elderly and then to engage the young. They are treated differently. So designing safe and conducive participatory training FGM, this was what I was saying. This is just a summary. Accessibility, you have to have, the place should be accessible. Recruitment, you should factor out the older, the young, and the older, the young, the middle-aged, and the small children. You have financial burden, maybe provide some financial support of what should be done, maybe give incentive, ground rules, set ground rules. You have to consider gender, don't go with only women, have both men and women so that they can listen to you. And you can have different methods of training. I think we can plan later on how we can have this session on how to design safe and conducive participatory training on FGM. So I'm almost finishing. We want to stress the fact that youth cannot and will not be ignored in matters in advocating for FGM. We may be young, but we have experienced FGM. We know how it feels, we understand it. Ending it is a battle we can win, it can end with us. We are ready for the action. These are words said by Esther Kamara 2018. So don't ignore the youth when you are factoring out to end FGM. Some of them have undergone this, some of them have friends who have undergone this and this. Yeah. Youth can really participate in ending FGM. And as you can see, creating awareness, education is central to ending FGM. If people don't know, you can't go and tell me to stop doing something if you don't tell me the consequences and the benefits of which. You have to show me both sides. You can't just come and tell me all the bad sides and you have not told me the good side. So education is very central to creating awareness on FGM. And as you know, FGM is global, but so is the movement to end it. FGM is everywhere, and anti-FGM campaigns, it's also global. And this means we are together, both men, women, and youth and young children. We have to act as a global in ending FGM. So I can just maybe have a short time for questions. Let me just read in the chat box. John Valley saying, but even the meetings to discuss some marginalized community are never invited. Most of it comes like that. True. The anti-FGM committees in the counties, as I've said, the people who are enforcers of the law, they want to block you from making policies or attending those policies in FGM. That's why, as I said, but currently what you need to do is to be friends of those who are making these policies and talk to them and make them understand this is what should be done and this is what should not be done. But it's not an easy process. You need to be dedicated and you need to stand out to win this fight. It's not easy. The same with GBV, it's not easy to win it because you won't be with these people throughout. You can go and make the policies, but core ground, as you say, core ground written is different. You can have good policies, but the people, they don't want to do whatever you have said. And the law enforcers, they don't want to support you. So it's a problem. So I think, thank you for John for that. I think I don't see any other question. Thank you for listening to me. I really appreciate your time and I hope you have really learned on FGM if you are blank. And as Alice said, it's not easy, but mostly in education. Yeah, what we can do honestly is educate and create awareness to the people on what is FGM, what are the complications, what do you think is good about FGM, what do you think is bad about FGM, and how we can fight FGM as a whole. And you can't do everything alone. You have to call people. As I said, we need to have a session maybe on and how you approach the youth, how you talk to them, how you engage them, so that they can support and see that you are having an idea that can be implemented. And you see, don't wait to have money. You can do everything voluntary. If you have a safe environment where you can do something, then feel free to engage the youths. So I think that's all. Thank you. You can sign the attendance form if you have not signed. Rosa Chelis look like to be an ambassador of FGM. How do I go about? I think, yeah, that's something you can all think about as Rose. That is something you can also think in the group project. Maybe your group can think about how you can conduct FGM trainings, the target community that you can target. But as I said, you have to look to the community. Who are they in that community? Who are the elderly people? You have to get basic information from that community, what makes them do FGM and what are the strengths and the weaknesses of the who are doing so. If you know the strengths and the weaknesses, you can fight it easily, like in Kajiado. So I think I don't have anything else. And I am done with today's presentation. With that, if you don't have any other question, thank you, Alice. I think we can still continue engaging, and yeah, we can still research more on FGM, but I think I gave a preview of what is FGM and what undergoes FGM. We have a lot that we don't know, but we can still research, read more, but I hope one group will do a project on FGM and we can see on how we'll curb FGM and maybe target one community. With that, thank you so much for your time and have a good evening. Let's meet tomorrow on the session of Introduction to Antenatal Care by our speaker midwife Azo. So I hope you will, yeah, Rose. I hope we'll enjoy the session. So we can have something from Rose, then we close the meeting. Rose, you raised your hand.
No, I was saying bye.
Okay, thank you. Have a good evening, everyone, and bye.